We saw it open the top of the skull, from the entry point all the way to the exit point, and removed a fairly large piece of bone. So what I was thinking at that moment was, as I'm removing the bone, if he starts to bleed, what would I do next?
A man was brought to the hospital with a crowbar driven through his head. He was still awake and talking when he arrived. 6 medical teams worked together to plan the surgery. The neurosurgeon decided to operate immediately. They successfully opened the scalp, but the real danger would come when the crowbar was removed. They first had to open the dura, exposing both the entry and exit points of the rod. He warned the team to prepare for massive bleeding, especially from a possible sinus tear. The resident slowly began to pull the rod back. He watched the bleeding site closely for any reaction. The moment the crowbar came out, blood began pouring out rapidly. This was exactly what he had feared. He immediately packed the wound with hemostatic material, and applied steady pressure to control the bleeding. He held that pressure for a full 20 minutes. No one knew the extent of the brain damage, but the patient was still alive. After controlling the bleeding, they closed the incision. All they could do then was wait. No one could predict whether he would wake up, or if his cognitive function would remain intact. 3 weeks later the patient returned. He came to the emergency department in a wheelchair. Even Angela Fisher did not recognize him at first. He was alert, able to communicate and thinking clearly. He had regained nearly normal function. 2 years later he was left with only mild weakness in one hand. The massive bleeding that nearly spiraled out of control ultimately did not defeat him.